Hi mamas, my name is Megan Norcus and welcome to Our Virtual Village. This podcast was inspired by a local mom group I went to that was a huge blessing for me postpartum. Now my hope is to bring those conversations and stories to a virtual platform so that you can feel like you're sitting on the couch right next to us at Mom Group. In this conversation, I talked to Dr. Kate Smith, who's the owner and founder of Nurture You Pelvic Health. She's a pelvic floor physical therapist with tons of knowledge. She's very holistic minded and goes through all the different things you should be considering when you're thinking about pelvic health, especially when it comes to pregnancy. Pelvic floor health is way more important than I realized, and she has so much knowledge about what to expect if you book an appointment with a pelvic floor therapist. She mentions things you can do at home to take care of your pelvic floor and so many other things in between, like diastasis recti and the risks of like hernia and hemorrhoids. This is like the TMI episode, so I really hope you enjoy and get a ton of value. Let's dive into the conversation. Welcome to another episode of Our Virtual Village. This is going to be a super fun one. I say I'm excited every time, so I'm trying to change what I say, but it's going to be a fun episode because you have so much knowledge to share. You are really holistic minded, which I really appreciate. So you've had so much value to give me, and now I get to give it to a bunch of other women out there. Yay! Thanks for being here.
Thank you for having me.
Yeah. I know we're going to dive in. We're going to go deep here. And I kind of just real quickly want to state like my intention of this podcast, because so far on like the birth worker episodes, I've only had like a birth doula, a midwife and stuff. And so you're actually the first pelvic floor therapist I've had. Of course, I would choose my own because you've been like so kind. But I just wanted to say like really why I wanted to record this episode is because even though I'm a nurse and I know a lot of the muscles in the body and things, when I hear pelvic floor, I just like thought just vagina, I guess. Like I really didn't know or understand the complexities that truly go into pelvic floor health. Mm-hmm. And I'm sure there's a million other people in my same position. So I'm ready to shine the light on all things pelvic health because I feel like there's a lot of misconceptions and confusion when it comes to it. So yeah, I'm really excited.
Yeah.
So I guess just catch us up to speed. First of all, with your story, because that was really intriguing to me. I think most people, including myself, don't really dive into this world until they're pregnant or planning for like a lot of changes in their pelvic health. But you actually had like some injuries and stuff that shed light on this work. So dive into your whole story.
Yeah, no, absolutely. So I started obviously working in orthopedics. However, I guess getting back to when I guess what led me into pelvic health, right? Yeah. So when I was, 13 or 14, I was in 8th grade. I cheered competitively. And of course I was the flyer. So I was the one that got like thrown up in the air and did all of the tricks and all the things, I guess you could say.
Yeah.
And
same. I actually did that too. And I have injuries as well.
Yeah, exactly. I think we talked about some of that. I feel like most people do if they did any type of like gymnastics or cheerleading, but I ended up getting dropped on at that time we didn't have mats like they do now, right? So I ended up getting dropped on a gym floor. The only thing that was caught was like my ankles and my upper body. And so I landed in a kind of like a V-shaped position right down on my tailbone.
Jeez.
It was, even to now, to this day, I didn't realize like until doing my own therapy that I was like, that was really traumatic at a young age. Sure. Definitely. Especially because I had to compete through it, which was also really challenging in itself, but
caused like a deeper injury, I would imagine.
Oh yeah. And just like the pain of having to do that and just kind of being forced into that and realizing that I felt like I didn't have a choice, I guess. But anyways, so I had landed on my tailbone, and after that I had excruciating back pain. Obviously I had the tailbone pain too. And that kind of finally led me to go see a physical therapist or an orthopedic physical therapist. And so I did a lot of PT in between, of course, my seasons and stuff like that. And while I was cheering, and that had helped a lot. But then I also was struggling with urinary leakage. So every time I was caught in a stunt, especially if I was caught really, really hard or high, I guess you could say, where there wasn't a lot of give to it, or jumping, tumbling, I would leak. I remember I had to compete with like back to back one day, and I didn't have time to use the bathroom. And by the end of the second, I guess, floor routine, I was like fully peeing my pants. I had to run off the stage and run to the bathroom. Yeah. It was definitely a lot. And so I think that So I knew, obviously, at that point, you know, I told my you know, coaches and stuff, and they were just like, oh, it's because you're overexerting yourself, all those things. And then when I actually got into PT school and learned about pelvic health, I was like, wow. But in PT school, for me, I only got 1 hour of any education on the pelvic floor.
Wow.
And so after that, though, I knew that, like, I wanted to get into pelvic health. It just took me a little bit of time. So I worked orthopedically and then got into pelvic health and realized that, like, by doing so, all the issues that I had probably stemmed from the tailbone injury because of the location of the pelvic floor, where I had a long history, still do, of issues with constipation, difficulty emptying, obviously pelvic floor tension. When I did my pelvic floor training, it was the first coursework that we did, or the first coursework that I did, that's like your introduction to internal pelvic floor assessment. And the instructor came over and was like, oh, you have a prolapse. That's an example of I was like, wait, what? Like,
did you stay here for the class?
Yeah, I know. Yes. So she actually did have some of like the girls come over and be able to see what a prolapse looked like, because we weren't actually learning it in that course, but she was able to see that, and I was like, but oh my gosh, like, what did I do to cause this, or like how did this happen? And I hadn't had any babies yet, you know. Now I have my 4-year-old and my 5-month-old, but I didn't have kids yet. And so I think it was because of, honestly, the injury and the effect on the pelvic floor and the straining with constipation, difficulty emptying, all of that had probably led to that. Yeah,
which is wild. Is that something that's like common, like even pre-pregnancy, that people have injuries and are like affected with issues?
Oh, like absolutely. That's why I know you had brought up like the holistic approach to pelvic health, where yes, I might do things a little bit differently than some other pelvic floor therapists, and I guess in the area or in the US and stuff, where I really want to focus on a full body approach. And so because all of that affects, of course, the pelvic floor a little bit too, because of just the relationship between the feet and the hips and the pelvis and the core and the diaphragm. But that's why I ask about like ankle injuries, even from a younger age. Like I had chronic left ankle sprain, so I know I shifted my squat, which is also going to affect pelvic floor. It's but crazy. It's all connected in some way, shape, or form. So
that's been the most exciting for me to learn, because like I said, it's mind blowing. I went to a pelvic floor therapist with my first daughter just because people, I don't know, I like to do things right. I'm like, I want to follow the rules. If you tell me to do it, I'm going to do it. So someone mentioned pelvic floor therapy. I'm like, I don't have any issues, but I'll go check it out. And she pretty much was like, yeah, everything looks great. And then that was it. So I never went back. And that's why I really enjoyed working with you, because even though like I didn't have like major issues or anything, you still like paced with me, you know, checking in, making sure I'm strengthening the right muscles to prepare for a second birth and things. So I remember something, because I believe the other person I saw before did like an internal exam and stuff. But, and this, just so everybody knows, if you're listening right now, this is like the TMI episode. So if like vagina talk isn't like your thing, then maybe this isn't the episode for you. But I remember when you were doing the exam with me and you press on a part literally of my vagina, and we're like, oh, this is connected to your hips. That means XYZ with your hips. I'm like, but you're touching my vagina. Like the way it's all like connected really is so insane. Like I said, even I'm a nurse, so like I knew that, but it's pretty mind blowing. So someone without any experience of like the body and things, I'm sure would be so surprised how connected everything truly is.
Yeah, it's really crazy. Especially when you can connect the dots of things that happen like even at a very young age, and they're like, oh my gosh,
like, wait a minute.
Yeah.
Yeah. And like you said, you start to compensate. So there, you know, even during like pregnancy, my second pregnancy, I'm like, I'm going to be super healthy. I want to work out the whole time, but there was certain muscles I need to be strengthening very differently than I thought. Like if I was just going to the gym and just doing squats, I could actually be strengthening the wrong muscles if I'm doing it incorrectly, even though it looks like good form. Like for my body, I may have needed to bend differently or whatever. So I think pelvic floor therapy in general, like having a professional look at people is so important.
Absolutely.
And I didn't actually even realize that. Even with my first, I'm like, okay, great, I went. That's awesome. It's like, no, you need to like work with someone. So, so I really love that. So then, tell me about like, as people get pregnant and things like that, like what changes? Because again, it's so many of your muscles. And this is the part that blew my mind, like really understanding and starting to think about like, it's not just like your uterus and vagina. There's uterine ligaments and so many things that like strengthen and I'm kind of like trying to use self-control because I want to talk about postpartum so badly, but we'll focus on pregnancy first. Like,
okay,
how does that, let's say with a first pregnancy, how does that begin to change? The muscles lengthen? Like, how can people like stay strong through all these changes? Like, what do you recommend for your clients?
Oh gosh, that's like such a loaded question, but we're going to dive into it. So yes, obviously a lot changes with our pregnancy, right? And that is not just, again, like our core and pelvic floor. That's just what gets like the most, I guess like highlighted, I guess you could say, or what people talk about the most. But I mean, from first trimester to second trimester to third trimester, you have a change in, of course, like center of gravity or center of mass, I guess you could say. And so that obviously affects all, all things about like how, what does our posture look like? What are our feet doing? Where are our hips position? Again, what is core doing? Rib cage, head cervical position is going to change obviously throughout our pregnancy. But I know more specifically with some of the changes, again, that gets highlighted is the core and the pelvic floor. And so, of course, as we progress in our pregnancy, we do have hormones that obviously create more ligamentous laxity within the pregnant body, which is going to create the need for more support from all the muscles and ligaments and everything around it. So during pregnancy, as we go from, I guess, more into that second trimester, third trimester, a big thing that we all talk about is diastasis or diastasis recti. So of course, yes, we know core changes. And I think what's important to know is that I get a lot of moms that come in and they're like, I want to prevent diastasis recti. I don't want to get diastasis recti or have diastasis recti.
Can you define that for us?
Yeah, so that is when as belly continues to grow during your pregnancy, those muscles, or specifically your rectus abdominis muscles, tend to stretch.
Like where a six-pack should be.
Yes, where a six-pack should be. Yeah, I know. You're going to have to, I feel like always into like anatomy and scientifically.
You're good.
Yes, those muscles in the center of our abdomen stretch, creating stretch to the tissue in that, what we call linea alba, or the center of the abdomen. And what's one thing to note is that is a normal adaptation.
That's what I was going to say. Like, it's normal for that to grow. You have a whole human living under there.
Yes, absolutely. I'm like, people come in and they're like, I'm so worried. I'm like, it's normal. It is a normal adaptation to pregnancy. But of course, coming in and seeing a pelvic floor physical therapist related to pregnancy and diastasis recti is know how to manage the pressure though within the core and within your abdomen as you are growing baby. Yeah. Because when we start to I don't want to say necessarily have issues, but can have issues, is if, say, for example, we are going to lift a toddler per se, or lift something heavy. If you're in your first pregnancy and you're holding your breath and you're not bracing your core properly, then that's going to put more pressure into that center part of the abdomen, causing coning. Or that could also set you up for risk for umbilical hernias, and also set you up at risk for things like urinary leakage or leakage with coughing, laughing, sneezing, because we're not able to manage the pressure well within the abdomen as belly is growing and baby is growing. And that's where also pelvic floor has to do a lot more to help support all of our organs, right? So our bladder, our bowels, obviously reproductive organs being uterus as baby grows and belly grows and all of that. And then also creating support and stability for the pelvis with all of that extra weight and all of the mess.
Yeah, because all your organs are like moving into different places and stuff. So it's just wild what our bodies go through and how we have to like just live our normal life while all of this is changing.
Yeah. And I was gonna say, and that kind of brings me into like with the organs and the shifting of that is rib cage position. So a lot of people don't even realize how much the rib cage has to expand and move to accommodate those organs. So that also sets us up for, I hate using issues, but some dysfunction postpartum. And that's why we have to kind of work back into not just looking at pelvic floor, but core and rib cage and all of that.
Yeah. And this kind of, I feel like maybe I should have asked this first, but just to dial it back, just in case people are totally lost, can you just define the pelvic floor for us? Because like I said, in my mind, I literally just thought it was like your vagina. Like I just thought of the floor of your pelvis. But what exactly is a pelvic floor?
Yeah, so the pelvic floor, I mean, it consists of multiple muscles, right? But of course, people talk about it as just the pelvic floor. So you have, of course, your pelvis. So you have your hip bones, and then you have the back of the pelvis where you have your lower spine or lower lumbar spine, and then you have your sacrum, which is that triangular shaped bone right in the buttock area, and then that transitions down to the tailbone. And so your pelvic floor muscles kind of sit like a hammock or a sling at the bottom of your pelvis from the front of your pubic bone or the front of your pelvis all the way to the tailbone. So that's why kind of talking about my injury, that if you have a significant injury to the tailbone or something like a fracture, that's going to significantly affect those muscles down there. And so those muscles help to, again, support bladder health, bowel health, your reproductive organs, create support and stability, obviously within the pelvic area.
Yeah. Okay, perfect. I love that, because I think it's just easy to think of like you said, your pelvis. There's bones there holding everything in place, but no, it's like so many muscles and ligaments that really need to stay strong and that adapt to all of this and then have to adapt back postpartum. So
absolutely,
it's super complex, which is wild. So when you're talking about diastasis recti, I was really nervous I wasn't going to say that right.
You could say it either way.
It's
I
a
feel
tongue
like it's
twister.
Yeah.
But since we're talking about that, what can people be doing to prevent that or to like support the normal separation of the ab muscles without like, ruining themselves?
Yeah, no, that's a great question. So when we're talking about diastasis recti, again, for me, I love to look at the full body approach. So I would say, how do I want to put this? Or where do I want to go, I guess, from here? So you have obviously like your core and your abdomen. And a lot of times, especially in some of our coursework, we talk about it almost like a canister. So the top of the core, or the top of that canister would be like the rib cage and the diaphragm. And then of course, like the sides of the canister are going to be like your rectus abdominis, so those front abdominal muscles. You have your obliques on the side, you have all of your back muscles, and that's going to be kind of that like center area of the canister, or I guess soda can or pop can or however you want to look at it.
I like this visual.
Yeah,
I'm
trying to see. Yeah, and then you have the bottom, which is of course the pelvic floor. But if obviously like that continues to grow, again, normal adaptation during pregnancy, we really have to manage the pressure within that space itself. So if there is dysfunction in the pelvic floor, then that's going to not allow the core to work as well. If there's dysfunction in the upper rib cage, in the mid back, and the diaphragm, then again might affect how core is functioning. So say you again go to hold your breath and you go to move something, that is going to put more pressure on the abdominal wall, creating more stretch. So the best thing that we can do is learn, again, either from a pelvic floor physical therapist. Obviously there is, I know we'll get into that, like home workouts and stuff like that talk about like hugging baby. We just need to make sure that we're doing it properly or bracing properly during our pregnancy to help manage the pressure. So being able to utilize our lower abdominals, engage core properly to help prevent pressure into the center of the abdomen, also making sure that pelvic floor is coordinating and doing what it needs to do. Because again, if we also like cough or we sneeze, that's, as everyone knows, that's a lot of pressure and force going downward. And so there's things that we can do, like as we go to sneeze, we can think about, okay, I have to hug baby and sneeze.
And when you say hug baby, what exactly do you mean?
So that's like trying to take your belly and utilize the muscles of the lower abdomen and almost like pull together and up, if that makes sense.
Totally makes sense.
We don't want to just like brace. So like hugging baby isn't coming from like the sides and around. It's coming from below and
like
up.
almost like lifting.
Yeah. It's like,
would it be helpful to like use your hands, like give yourself like a visual to be like, okay, I'm hugging up my baby and squeezing up. Like,
yeah,
that's
you could.
The motion you're going for.
Yeah. Putting your hands on your lower abdominal and thinking like, okay, do you feel it come up, like in and up? Yep. And so feeling like you're supporting the abdomen versus like, we're not bracing. We're not trying to push the belly out, because that's going to be the opposite.
Yeah, that makes sense. So do you think it's important for people to get seen before they even start like a pregnancy journey, even if they don't have issues, or what issues would like give them, give somebody the inkling that they need to come see you? Or
Well, so I guess the first question with before, absolutely. I see a lot of clients for preconception, just to, again, make sure that everything is going well, especially if they've had like past injuries too, or past like history of a low back pain, past history of leakage. past history of tailbone pain, anything that's going to possibly carry over into their pregnancy. But absolutely, I'm like, first trimester, call me. Because I think everyone should see a pelvic floor physical therapist or occupational therapist and their pregnancy at some point. Of course, the earlier, I feel like the better, because that allows us to get to know your body and give you individualized care, but also really set you up for that success through your pregnancy, labor and delivery, and then postpartum. However, some of the reasons that people do tend to come see me, because of course, if everything is like going fine, people tend to not come in as soon, which is, I understand that. I'm the same way with certain things.
I didn't even know what it was. So
I like half the time I won't go to the dentist unless like, which is like a whole thing. Don't do that. Same thing with pelvic floor. Let's try to be proactive versus reactive, right? So when it comes to, issues that might come up, obviously the biggest thing is urinary leakage. We hear about that. Leakage with coughing, laughing, sneezing, regardless if you're pregnant, regardless if you're in your third trimester. Yes, it's common, but is it necessarily normal? No, because that means that you're probably actually not managing your pressure right. It might not actually even be the pelvic floor is the issue. It could be what's going on elsewhere as a whole too.
So let me just highlight this very quickly. So it's a hot take. If you have leakage, it's not normal. Whether you're pregnant or 30 years postpartum, there's something going on and it can be fixed. Is that what you're saying?
Yes, absolutely. There is always room for improvement. I think the oldest client that I had seen was 101.
No.
Yep. Mm-hmm.
Oh my goodness. Yep. She's like, I'm going to fix this.
Yeah, because it's quality of life, right?
Yeah,
so,
for sure.
And that's where, obviously we might be digressing a little bit here, but with pelvic health, it's important for longevity. So going and seeing someone, regardless if it's just like a little problem, same thing. They're like, oh, well, I just put a pad on it. You hear CrossFit athletes say, like, I just wear black pants. And it's like, oh my goodness. Obviously there's dysfunction going on somewhere. It's just whether or not you're ready to address it. But there is help and support out there. But yeah, some of the issues that people are, come and see me for, obviously any type of urinary leakage, any type of urgency, like feeling like you can't make it to the bathroom, your increased urinary frequency. We really should be going about every 2 to 4 hours. Anything more frequent than that, we really want to be looking at to see if it's too frequent. Obviously, depending on, we look at, fluid intake, diet, stress, sleep, all the things too, holistic approach to that. But any type of bowel issues, constipation, even urgency can be related to the pelvic floor. Of course, any pain, tailbone pain, hip pain, low back pain. I know a big one that I see a lot of, even just like postpartum, is like plantar fasciitis, but they're postpartum because there's a link to obviously all the changes that occur during pregnancy, intimacy, right? So any pain with intimacy is not normal. If we're talking about it early postpartum, yes, that can be common just because obviously all the changes that occur. But if that continues, then that is obviously not normal. We want to be looking, deep diving into that. And that's why usually with my postpartum mamas, I like to see them before they're intimate. So that way we can kind of see what's going on and also give you tips and tricks and things like that to make it as most pleasurable and enjoyable as I guess we can.
That's the goal.
Or pain-free, right? And then, any type of, like I said, chronic low back pain. I see, again, some men too for chronic low back pain, hip pain related to the pelvic floor.
My husband was like, wait, I have a pelvic floor? I'm like, yes, it's not just a girl thing. A pelvic floor is just your pelvis and all the muscles with it. He's like, oh, so should I go? I'm like, probably.
Yeah. I know lately it's been so fun because I've been seeing so many spouses. I've had like 3 spouses on my schedule recently and I love it. It
makes the dynamic is probably so interesting.
It's so fun.
Like asking them about their sexual health, you get like both sides of it.
Just a little bit,
That's hilarious. I love that. So cool. So I guess, what if someone like, just to, make sure we're finishing up here in the pregnancy section of my brain that I wanted to talk to you about. What if someone literally just can't afford a pelvic floor therapist or can't find one where they're at or something like that, and they're pregnant? They obviously hopefully don't have major issues, but just want to support their body or be proactive without seeing someone. Like, is there things they can be doing to protect their abdomen and pelvic floor, like as they grow, so they don't ruin a bunch of muscles?
Yes. I mean, there is definitely a lot of programs out there. I would say, of course, well, like even too with now me being on this podcast, like I'm an open book, so you'll have access to who I am. So I never I never mind if people reach out and say, hey, I can't maybe afford you, or I'm in this location. Do you have anything that you recommend? Do you have any programs that you recommend? There's a lot of good ones out there that have been done by other pelvic floor therapists.
It's just like totally virtual.
Yep, that's virtual. But at the same time, everyone should have some form of individualized care, even if it's just going for one visit. If you can afford that one visit, just to be able to say like, okay, this is what's going on. This is how we can at least get started with obviously helping things, or just like knowing,
in the right direction.
Knowing where you're at. Of course, there is some insurance-based providers too. So if you have insurance, obviously, you always have access to that. Of course, I am a self-pay out-of-network practice. You just, we're able to deep dive, obviously, a lot more with that. But of course, there's always options out there. So that's where, again, like, if you can't, say, afford like a self-pay out-of-network practitioner, that there's other avenues. It's just, it might look different. But definitely, like, there's a lot of really great, like, especially with pregnancy, labor, and delivery prep, towards the end of, or into that third trimester, starting to really hone in on, mobility and really opening the hips and the pelvis can be really, really helpful just in itself. And focusing on breathing techniques, hypnobirthing even can be helpful with that. To knowing how to breathe will also help you to relax pelvic floor a little bit more. Yeah.
It's crazy. Yeah. Breathing, like how the way breathing has to do with your pelvic floor is just crazy. It all blows my mind. And I remember like the closer I got to my third trimester and things, the way you like assess, and even we did pushing positions to see how my pelvic floor responded to me breathing in certain areas. So is there anything you see like as far as labor positions and stuff that like is super helpful, or that you can share with someone going into their third trimester?
Oh yeah. I mean, well, I was going to say that is
it's
like
very broad.
I know that is a loaded question, Megan. Yeah, so obviously for labor and delivery prep, I guess what I would focus on as a pelvic floor PT, or what someone would come in to see me for, or like you said, towards into that third trimester, is yes, we're working on, switching gears. We're still focusing on strength, but I tend to focus a little bit more on, again, relaxation, mobility, opening the hips, opening the pelvis, because when it comes to labor and delivery, obviously every labor and delivery is very different, but there's things that we can do through each stage of labor to help encourage babies, way down through the pelvis, and also to their positioning. And so, I think you and I talked like early labor, right? We want to be focusing usually on those like wider hip movements, your deep squats, your really like deep, wide open movements to encourage baby through or down into the top of the pelvis, or known as the pelvic inlet. Once we get into active labor, closer to transition, we're focusing on more like those asymmetrical positions, trying to get baby down through that mid pelvis, rotation through to be able to transition into, of course, transition pushing stage, where we need the pelvic outlet, or that lower part of the pelvis, to be able to open. And so by doing all of those mobility exercises also through your last trimester, that's going to help with those positioning and things that you need to do during your labor and delivery, depending on what that looks like. Yeah, it could be very slow or it could be very fast. So it just really depends.
Yeah, I'm like picturing like my labor, because I didn't, like I mentioned, didn't really see a pelvic floor therapist except for that one time with my first daughter. So with my second, I mean, you had me doing all kinds of stuff with my hips, and like the mobility really truly is so important, because I think some people like want to be strong, so they just like work out or just like do deadlifts or something. I don't know, squats, which is great, but like the mobility and just moving your hips differently, like there's so much more that really goes into like what your body is about to go to and how you should like prepare. And then I'm like thinking, because actually I haven't, well, I saw you postpartum, I guess, but I haven't like had this full conversation about like my whole labor. I'm picturing in my mind when you just said that I was during labor and right before transition, my doula had me lunge with like my right foot forward and my left foot forward, and it was the worst ever, like in the
Don't
best
want to
way.
do it. Yes.
Yep. So yeah, it really is so crazy that it paid off. All my hip movements and mobility, like, I probably couldn't even like cracked my leg up that high if I hadn't have done stuff like that in the middle of labor, trying to lunge and stuff. Like if you want to get in a good position, especially, if it's unmedicated and things, like it's truly important to do preparation work.
You really do. And and same thing with my labor and delivery, just, ping-ponging, I guess, off that, like, when my water had broke. So I was obviously well into active. I mean, that pretty much sent me into transition at that point, but I was hands and knees in a, what's the word? Like a fire hydrant dog position with my knee up on a peanut ball. We're rocking side to side. So I'm like hands and knees, one knee down, one knee up, rocking side to side. And that's how my water had broke. Obviously it was extremely intense, I think, because of the positioning, but then that went right into transition, and obviously baby was born a little while after that, but
so cool. Yeah, but that's when all the prep
mobility,
work pays off.
Being able to like lengthen the adductors or lengthen your inner thigh muscles to be able to get into a position like that, or a lunge position, or a Captain Morgan position, I guess you could say, because we need that for baby to transition through, the mid pelvis. And with that being said, though, say, obviously I know with your labor and delivery, mine as well, unmedicated, but even if we are medicated or have an epidural, we can still get into those positions. Mm-hmm. So that's another thing to, be mindful of.
For sure. Yeah, that's wild. Man, some of these conversations sometimes just get me too excited about being pregnant again.
And I'm like, oh no.
You're like, I can't do it again. Yeah. It's so funny. So let's see, where do we take it from here? There's so much to like unpack. I guess we talked about birth. Is there anything else you want to cover about like birth? So prepare for it, be consistent, at-home exercises, all the different things really matter, because your pelvis and your muscles, like we're talking about, are holding so much more weight. There's so much like elastin and things that are relaxing your muscles. So like you have to work on that mobility consistently for it to pay off. You can't just be like, oh, I'm 40 weeks. I should give birth any day. I'm going to stretch a bit. Like it's really a progression, like as your muscles change, like really taking care of your body throughout pregnancy.
Yeah. And I think one thing that I had forgotten to hit on that you had talked about was the different positions like pushing that we had went through, right? So of course, yes, we go through labor and delivery prep and like, again, the stages of labor and stuff like that. But one of my favorite things to do with clients is be able to go through some of those deep breathing techniques that we can utilize whether we're unmedicated or medicated, or have an epidural, to be able to help lengthen pelvic floor. Because I think that thankfully now more education has come out there, but at times, like people thought that their pelvic floor pushed the baby out. And it's like, no, the uterus does what it's supposed to do to help push the baby out. Pelvic floor needs to be able to lengthen, and we need to do that through proper breathing techniques, because we shouldn't be holding our breath and bearing down. Yes, obviously there's times in labor and delivery where I'm like, you got to get that baby out, do whatever you need to do at that point. But going into it, if we can really focus on proper breathing techniques to be able to bring baby down, then that's going to be more helpful and more effective for you in preventing like injury and stuff like that too.
Well, because everything's so intense, like of course you can hold your breath or tighten your shoulders, and you hear even in like hypnobirthing and stuff, they say like, oh, relax. Like it's not just your mind. Like you obviously have to relax your mind, but truly the breathing, or like when you like do the horse lips and all these like silly things that come up. When you listen to like birth courses and stuff, it's like, is that really helpful? Like it has everything to do with your pelvic floor, just opening and releasing and not holding on to tension, even subconsciously.
Oh yeah.
Like, it's crazy.
It is crazy. No, it's so fun.
Complex.
I mean, like that's why I'm like just practicing like just relax the jaw and everything. Mm-hmm. Like I feel like just by, at least for me and my experience from my first birth to my second, that was one of the things that I changed like 1,000, I guess, %, was like the whole time with this last pregnancy or with this last labor and delivery, I did not even let my like teeth come together. I was like, just keep it open, like let it relax, like all the thing.
Yeah, because your jaw and your hips are so connected.
Exactly. Yeah, jaw and pelvic floor is connected. So
it's like a phenomenon. It's crazy. I love that. So okay, so labor and delivery. Let's move on to kind of postpartum, because this is another just huge thing. The people want to bounce back. There's like this whole bounce back culture. I mean, I have a friend of mine who's like, I'm already doing walks and stuff. I'm like, oh, you had your baby 2 weeks ago. Like, please do not walk, like anywhere pretty much. Like my midwives are pretty strict. I call them strict all the time. They're, probably just normally strict. I feel like they're like watching me or something. I like snuck out of my room to get supplements like only a few days postpartum. I'm like, don't tell them. Like they wouldn't.
5 days within the bed.
Yeah, I'm like, please don't take me to jail. I'm just kidding. They don't care that much.
Yeah.
But they like kind of beat it into my head, respectfully, of course. But some people don't have someone taking care of them like that and making sure that people know they really should rest. So in an ideal scenario, what does it look like easing back into even literally walking around your house? Like in the ideal perfect world, of course, you know, this time both of us had toddlers and stuff. So it's hard to rest. It's even as a woman in general, it's hard to just sit still. But so what in a perfect world, how do you ease back into taking care of your pelvic floor and movement and things like that?
Yes. And again, I know it's so hard because I'm like thinking about even, you know, I bring a lot of like, even to like my personal perspective into things. And I was the one that like after my son the first time, I was vacuuming at like day 3. Should I have been doing that? Absolutely not. That's probably why I bled like longer than I should have. That's probably like why I had a little bit more pressure, but still it's like, you don't know. You hear, again, you may or may not know, or you don't know what you don't know, I guess you could say. And that's even me as a pelvic floor PT. I like tell people all the time, I'm like the 5-5-5 rule. So 5 days in the bed, 5 days around the bed, 5 days around the house. Ideally, yes, that's like what we should be doing. And honestly, for me, I would say I did a good amount of that, just because, with how my labor, like I had an amazing experience, but I did have one slight complication, I guess you could say. I had my cervix prolapsed during my delivery. Thankfully, me being a pelvic floor PT, I was like, oh, it's fine. We're good. I'm fine now. Yeah, I got this. So it was funny. My midwife was like, oh, this is like the best person for this to happen to. But because of that, I had that in my mind to say like, oh, I probably need to like not do this.
It's like a blessing in disguise.
Exactly. That's I said that too. Like literally the day I gave birth, I was like, that was actually probably a blessing because it's gonna force me to have to slow down.
Because with a toddler, it is so hard not to stand up. My daughter was like she was 2 at the time. Mommy, I want you to do this. I'm like, no, grandma's gonna help you, or Grammy, you know, is gonna do this or take you on a walk. She's like, but I want mommy to take me on a walk. I'm like, I can't, but I want to, because it's like heartbreaking because, you know, you're going through that transition of having a new baby. So I'm like, I want to do everything for you, but you literally just have to use self-control to force yourself to rest.
Yes.
So hard.
It is really hard. And so, I mean, obviously, yes, that 5-5-5 rule I do think is helpful. And then it's obviously also to like listening to your body to a certain extent, you know, depending on if we have a like uncomplicated delivery, whether that be vaginal or a belly birth, there is things that we can do within, you know, that first week or that second week, and then diving into that a little bit more in the 3rd week, 4th week. And so usually with my clients, like I think I did for you, once I knew baby was here, I was able to update your program to say, okay, like these are some things that we can do before you come in to see me for pelvic floor therapy.
Which would be what? Do you have like a couple examples?
So examples would be like starting from breathing. So like 101, so diaphragmatic breathing when you're nursing baby, when you're lying in bed, side lying, you know, anything like that. If you have an uncomplicated vaginal delivery, within day 2, we can start to take a deep breath in. Can we engage those lower abdominal muscles, or can we engage those core muscles properly that we would worked on, obviously, like during your pregnancy? Obviously, if we have a belly birth, that has to wait a little bit longer, but things like that, 101, even to, you know, once we are out of the bed, even just standing on one leg, we don't realize like how much balance changes and is affected, obviously, postpartum. And then, doing that in obviously like varying positions. Of course, when we get into like mobility and stuff like that, like cat-cow is something we can easily do. Book openers. So obviously like taking the hand, opening up the chest and really trying to stretch, especially if we are nursing, pumping, bottle feeding, all the things, like feeding any child at all, we need to be working on that mid-back mobility. So that's stuff that you can do just from the first couple of weeks.
Which is so foundational. And even like, I don't know, maybe someone's listening to this or you're like me, and it almost like made me roll my eyes. I'm like, what, you think I can't breathe now that I had a baby? But like truly just connecting your brain with these muscles, because and correct me if I'm wrong, but because they've gone through so much change, like your brain can send a signal to be like, oh, stand up. And your body is literally like, whoa, wait, these muscles are in a total different spot. Like your organs are moving back into the position they were in hopefully before and things. So like your brain literally has to remember how to do these things. Like your muscles are functioning differently. You have to respect that, or you will pay. Like you will pay for it.
Well, and that's, I think, what, you know, it's hard because I don't like how some stuff is marketed, obviously, online when they talk about like mom butt and things like that. And it's like, well, like, or I'll have clients be like, I did all of this glute work. How am I so weak in my glutes, like postpartum, all the things. But it's because of that center of mass and that center of gravity changes. Things are having to work at a different range now, right? So it's like
hard to like isolate one muscle.
Yeah, they were strong when you were in that, I guess, posture and positioning. And now they have to learn to work in their new normal. So yeah, absolutely.
So yeah, like easing back into movement, like literally just breathing, like you said, stand on one
posture.
leg.
We talked about tits over toes, right?
Yeah.
So
explain that to me, because I still tell myself that every day, and I'm like, it's frustrating.
So I guess thinking about, if we're holding baby or carrying baby, that we don't want to be like locking at our knees, thrusting our hips forward, leaning the chest back. We really want to think about keeping a soft bend in the knees, slight shift forward. So where essentially, your chest or your tits, I feel like everyone remembers that, right?
Yeah, I love it.
Is over your toes. So that will allow you to be able to stack rib cage over hip a lot better, which will help to manage pressure if we do have diastasis or diastasis recti, but also for pelvic floor health. And that's a lot of times when I see moms, of course, after having, a belly birth or a vaginal delivery, they might have more pressure down in the perineal area or in that vagina area or vaginal area, whether we do or don't have a prolapse. It's just, what happens afterwards. And just by changing the posture and the positioning while we're standing and while we're baby wearing and things like that can be really, really helpful. Another thing though, I realized too, postpartum is being able to hinge correctly for picking up baby, whether that be on and off the couch, in and out of the bassinet, in and out of the car seat, whatever that might be, setting baby down to change their diaper, being able to shoot your hips back and actually hinge through the hips versus using your back to move baby.
This one's so hard for me, and I think it'll probably be impossible to ask you too many more questions about this on a podcast, or most people, like, you need to stand up and show us. But this part blows my mind. Like, there's so many times in your office, both when I was pregnant and postpartum, you're like, okay, let me see you like bend over, and you're like, you're doing it wrong. I'm like, God bless. Like, so frustrating. Like, the muscle memory you build that is wrong is crazy. So yeah, I remember when my daughter that I just had, I transitioned her into like a pack and play, mostly just to protect her from her older sister, like running her over on a bike or a car or something. Because obviously my toddler's going crazy. So I'm like, I need somewhere safer. So I put her in a pack and play when she was still like pretty young, just to keep her caged in. And I threw my back out. I'm like, oh, Dr. Kate's going to be so mad at me.
No, I'm never mad at my clients because I get it. It's true. I mean, like, even
you just do it. I just went to pick her up and I'm like, dang.
Yeah. But also, I would say with that being said, though, like, I mean, again, things happen, right? But of course, I don't want that. But I've even thought about it myself. Like, I traveled with Maddox, my youngest, he was 3 months old at the time, just 12 weeks. And I stayed at a friend's house and we had a pack and play, but it was one of the pack and plays that's like completely all the way down to the ground. And of course, both you and I are not very tall people. And so the pack and play literally went up to here and he was on the floor and my arms are definitely not that long. So I was having to like completely like hinge. Like there was no way to do a proper hip hinge. I just had to do what I had to do to get the baby out. And unfortunately, sometimes we have to do that, but hopefully if you've been doing it correctly for a longer period of time, it sets you up for less injury to do something like that.
No, that's literally how I threw my back out. And because I didn't really use the pack and play much with my first daughter. I don't know why. I just never really busted it out. So I didn't, like, when I put my second daughter down in there, I'm like, and threw my back out. I'm like, oh wait, there's like a bassinet attachment for this reason. So someone freshly postpartum does not throw their back out trying to bend down with 12 or 15 pounds in your hands, with a baby. It was crazy. So what are some things like how would a mama know that they've done too much? Like that they need to like ease up. Back. Like, okay.
Any symptoms. If you have, and that's what I tell moms, I'm like, if you're having any leakage, that is a sign that, of course, obviously you need to be seen, but we need to back off a little bit, especially when is it occurring? Is it happening like while we're moving and while we're squatting or, lifting something? Maybe that's a sign like, hey, we're not quite ready for that. Pelvic pressure or, any type of pressure down into the vulva, down into the abdomen, again, is going to be a sign to say like, hey, we need to back off. Sometimes that could be like if we're baby wearing, of course, like we all know that babies just want to be held and, some babies need that connect, that closeness, or need to just be rocked all the time, again, like Maddox. But yeah, being able to find ways to like, maybe we're like baby wearing, but bouncing on or bouncing or sitting on a ball, or sitting down and swaying or rocking side to side or something like that, to be able to get like the pressure off. Or pain, right? So low back pain, pelvic pain, tailbone pain, especially postpartum. I see that a lot. I know myself have experienced that. I've given my history with both of my pregnancies, and postpartum. And yeah, I just say symptoms. So pain, pressure, leakage, another thing, bleeding. Yep. That's what I was just about to say. Bleeding, if we are bleeding for an extended period of time, or you notice that bleeding gets better and then it gets worse again after we are active, then that might be, hey, like we need to maybe back off a little bit, but that doesn't mean completely also stop doing anything. It's just that we have to figure out, okay, where are you at? Yeah. Maybe we do need to back off a little bit. I know a big thing too is like running, right? So I always tell my moms, at least if we can wait 12 weeks before like going back into running, then that's going to be helpful. Or if you end up doing it beforehand, don't tell me. No, I'm just kidding. But just, yeah, you're having symptoms. It's the same thing like during pregnancy. Like my moms that are like, is it okay if I keep running? I'm like, if you are symptom free, like if you can run without any leakage, without any pelvic pressure, without any pulling into the abdomen, without any pain or pelvic pain, sure. Pregnancy. Yeah. Yeah, so it's just symptoms are, it's our body telling us that there's dysfunction there and something's not quite right.
What about postpartum when you talk about running? How do you ease back into it?
So that, I will say that's kind of like person dependent a little bit. Yeah. It's hard because like just with my practice, I don't have like a set time frame because everyone's level is so different. I just say you always want to increase like distance and time versus speed. Because obviously the faster the speed, the more that's going to tax your muscles and put on your pelvic floor. So, start with maybe like a 30-second, like quick little jog to like the mailbox. Yeah. See how you feel. You can go a little bit farther next time. Start with a run walk. And just easing yourself back in there and kind of, obviously next day, how sore are we? Where are we sore? Like some people will be like, oh, only my left hip hurt. And I'm like, yeah, it's because we obviously have these imbalances. That doesn't surprise me. Yeah. Or maybe my feet hurt, or maybe I did have pelvic floor pain. So that kind of gives us an idea too as to like where you're at. And then we can kind of go from there.
And running's like the ultimate amount of like pressure and intensity you probably could put on your body and pelvic floor, I would imagine.
Yep.
So yeah, easing back into anything, even like walking. Like don't just be like, I think I'm gonna try to start walking a mile. Like you said, like just literally walk outside first, like see sunlight for the first time in a few days, like literally ease up, ease back into it. And I was kind of like smiling, almost chuckling while you were just talking. I feel bad. Probably like, oh, what's so funny? But I remember when I saw you postpartum, I don't know, maybe you like, I don't know. You've seen so many people. So you're like, are you preparing for a run? You asked me. And I'm like, a run? Where am I running? I'm not running anything.
I think you probably did. I always have to ask because it's the ones that come back and they're like, oh yeah, I went for a run. And I was like, did we have plans for running? So I always have to like,
I think
make
you
sure
asked me, you're like, wait, were you prepping for a race or something? I'm like, race where? Am I racing somewhere? I hope not.
You'd be surprised.
If so call the cops because I don't run.
Yeah, no. But I mean, obviously like with all of my postpartum moms, even if they don't have plans for running, I'm like, you're gonna have to chase after your kid at some point
for sure.
So we need to be able to like, let's at least like funny. Work in some plyometric stuff like that, so at least we know that like
for sure.
Yeah, or
you can
if you
take off if you need to.
Yeah, or take your kid to a trampoline park
for sure. Okay,
that's gonna happen probably
Olympic
at some point
level pelvic floor stuff.
Yeah.
That's amazing. So okay, cool. I think that's really important because there's a lot of misconceptions about easing back into work, and that I think even just like the whole point of this podcast, that's one area that I really want to shed light on is easing back into physical activity, because I don't think our moms really knew that. And like there's a lot of like people in the generation before us that really deal with a lot of incontinence and leakage and stuff, and is perceived as normal. And like you said, even though it's common, it's not normal. Like you really should have eased your way into it. So I'm here standing in the gap for our generation. Hopefully we can save a few ladies from that.
And I think another thing that people don't even, or I guess like postpartum moms, they can be so focused on, again, that like bounce back culture or like getting back into activity and everything like that. But something that has been really like eye-opening for me is that I was able to work back into a lot of like exercise and stuff like that early on with my first pregnancy. And honestly, with this last pregnancy, physically, I probably could have done the same, but I was not sleeping. And so that's another thing that we look at, again, from that full body or holistic approach to treating postpartum moms is another thing. If you're not sleeping, I don't want you going out and doing a crazy workout and exercise. Like your recovery and your sleep is so much more important postpartum than going and getting a 60-minute workout in too. And that's where like for me, I mean, like I'm 5 months postpartum now, and I have maybe done a handful of like actual like full workouts because I've just been so exhausted. So doing some like, I guess, movement snacks, I call them, throughout the day to be able to like work in some exercise or like doing some gentle yoga and things like that is still doing something, or breathing. Yeah. Gosh, if you just like lately I've been meditating a lot.
Yeah, some intentional breathing.
Some intentional breathing is still going to be helpful for your recovery, even if you can't get into that like back into exercise. For sure. Everything.
Which I feel like is such a crazy like time warp phenomenon that happens postpartum. Because I talk to so many moms, just even in mom groups and different community things like that, where they're like, I mean, it's been like 6 months. Like I should have already, like, I feel like there's so much like shame and like guilt that people feel like they should be doing this or should have already this. And it's like, it's okay if your healing journey is not linear. Like for me, I've had a decent time, I guess, with like pelvic floor recovery, but I struggle with headaches and migraines and some other like upper cervical shoulder craziness. So sometimes it weighs on my mental health. Like I want to be more active. I want to do more, but I love that you're like giving moms permission to like just rest. Like you literally just put your body through so much just by being pregnant and having a baby. That's not like birth wasn't the event, you know, like we were preparing for that the whole time, but the muscles in your pelvic floor and like we were talking about uterine ligaments and things just supported so much weight for so many months, and then you did birth and now you're recovering. Like that's a massive life event, not just like one little like thing that happened.
Yeah, you're not gonna just like 6 weeks later like poof, like
yeah, exactly. Great. Now I can go on a run and have sex and do all the things. It's been 6 weeks. Like that's not real life.
Yep. Exactly.
So I'm glad. I like to just like give people, you know, like permission to literally let your body like progressively heal. Like that's okay and that's normal and recommended actually. So that's good. So what about like, I just wrote down here real quick as we were talking, like what if someone had a really bad tear or like you said prolapse? Like how does that change recovery, or is there anything they should know about easing back in?
Yes, I think when it comes to tearing, right? Well, I think what I also want to say about that is I feel like moms, like if they had a tear, especially to the moms that like I've worked with, are like, oh, I tore. And I'm like, that's okay. Like there's so many factors that affect tearing. It's not just one thing that you did or did not do. And honestly, it's not something that you did not, there's nothing that you didn't do that would have like, I guess, caused that essentially, right? There's a lot of factors that play into that. And so that's where, you know, of course, like with me as a pelvic floor therapist, I would say like, my goals is to prevent you from a 3rd and 4th degree tear, essentially. 1st and 2nd degree tears, yes. Are they extremely common? Yes. Are they likely? Yes, depending. There's just, there's so many factors that are in play. But when it comes to healing, of course, yes, if we do have like a 1st or 2nd degree tear, those do usually heal extremely well. Obviously, yes, there's things that you want to be careful of. Like I know for me with my first, I had torn and, obviously had sutures and things like that, but I had to like even watching like scooting forward like on a couch or in bed to just make sure that you're like not pulling on those sutures and just allowing like ample like healing time for that. But most heal really, you know, of course, heal really well. Your 3rd and 4th degree tears, they do heal really well too. They just take a little bit more time. And so that's where coming in and seeing me, usually then I'm like, okay, well, we're going to, you know, obviously hold off on intimacy and things like that until we have fully healed a little bit more. And then obviously with 3rd and 4th degree tears, we have to look a little bit more at bowels and stuff like that too, depending on what's affected. So I would think it's just like more like listening to your body too after tearing and being able to support yourself. Sometimes you can sit on like
I've heard that,
like a donut or some type of like kind of like the tailbone seats just to help not put too much pressure on there if that's causing discomfort.
And I guess you just made me think of like little donut pillows and stuff. What about hemorrhoids? I actually don't know a ton about them, to be honest. Praise Jesus, thank you. God bless everything in my body that has prevented me from not having one.
Yep.
Of course, I want more babies, so fingers crossed. But dive into that. I think that has a lot to do with pressure.
Yeah,
right?
it does. I was going to say, it's a lot of like pressure management. Obviously, like after any type of, well, that's why they come on during pregnancy, right? So
I was going to say, is it during pregnancy or during birth or postpartum? When do people mostly get them?
Any of it,
all
right?
Of it.
Yeah, it could. I mean, you could not have any during your pregnancy, but you could have more postpartum. But yeah, like during the pregnancy, same thing. Like, but there's a difference too between like full active hemorrhoids that are like painful and red and swollen versus hemorrhoids that really aren't. They almost kind of look like, I don't want to say like skin tags, but kind of. They're just like something that's been there for a while. And it's like because of, again, possible improper pressure management, constipation, stuff like that.
Blood vessels, right?
It's a blood vessel. Yep. Mm-hmm. And so as you go through obviously labor and delivery, depending on what that looks like, depending on how hard we're pushing, all the pressure that's coming down, that's why we see hemorrhoids pop up afterwards. Yeah. And sometimes a lot of times they don't pop up right away. They usually end up coming on at like 3 weeks, 4 weeks, 5 weeks, 6 weeks postpartum. But some of that could be because of all of those imbalance that you have postpartum, not maybe exhaling when we lift baby, putting more pressure into the abdomen. Of course, constipation, being afraid of obviously the bowel movements postpartum. Yeah. That's a real thing. So
I didn't go through that with my first because I had a C-section the first time. So the second time I had, was asking more questions because I was fully expecting to have a vaginal delivery the second time around. Praise God, I did. And I had experienced that too. Like the fear of pushing anything out of anywhere down there is very intimidating.
Yeah. So that's where, of course, we want to make sure, I talk to all my clients. I'm like, make sure wherever you are, whether you're home, make sure you have some magnesium on hand. Take that literally, obviously, before delivery and everything, but also right away postpartum.
Keep everything soft.
Keep everything soft as much as you can.
And with the food you're eating and stuff,
yes.
like, some people hop right back into their normal diet. And it's like you really need to be not only gentle for your digestion, that has so much to do with your healing, but also with eliminating, really want
warm
to be gentle.
And things like that. Yep, exactly.
So important.
Yes.
It's huge.
Yes. Yeah. And so hemorrhoids too, and we see that actually a lot in like men too. And again, it's like a pressure management issue. So again, that could be, we just have to see what's going on at the body. I'm I can't say it could be one single thing because it's usually not. But it's same thing with women, especially if those hemorrhoids continue to linger postpartum, then we know that obviously there's some form of like dysfunction going on there. Yeah.
Yeah. And I guess just to bring it kind of full circle, because we were talking about diastasis recti as far as like preventing it. So if someone did, every woman, like you said, is normal for their abs to begin to separate. How do you slowly help them to come back together? How do you know when there's an issue?
Yep. So when I see you for that initial assessment initial assessment, if you're a new client, obviously if you're a returning client, I go through kind of the same thing. Obviously postpartum, we don't have to go through all the history. Yeah, exactly. Yeah. So you still have to go through like the whole assessment. And so I do check obviously core. So we're looking for, again, technically with diastasis recti or diastasis, it's classified as like a 2-finger width gap in the abdomen as we lift the head and the shoulders off the floor or off the table. But that's just one like small little check, because you could have like, there's some clients that I have seen that are like years and years postpartum that have, maybe like a 3-finger width gap, but they can manage their pressure in their core and in the tissue in the middle of the abdomen so well that the gap doesn't really matter because they're managing it so well. And so that's where, yes, of course, we want to improve that, especially if we are early postpartum, but we're looking at other things. We're looking at the depth. Like, can I take my fingers and can I place them like down through the center of your abdomen? What does it look like when we do engage lower abdominals? What does it look like when we factor in rib cage position? Does that, again, close the gap? Does it create more pressure? Are we what's called coning? I feel like most people kind of know what that is now, but coning or bread loafing in the abdomen, when does that occur? How is it occurring? So it's a little bit more in depth with that. And I think what most people, or what some programs, I guess, because I know we've talked a little bit about just like online programs, and there's a lot of really, really great ones out there. But sometimes depending on the program, they focus so much on the lower abdominals and TA activation that they forget all about the upper abdominals, the rectus abdominis, and rib cage. And that is so much of what I see is because of that rib flare creating more of a diastasis above the belly button versus, you know, being weak in your transverse abdominis. And so I think that that's something that, again, a lot of like programs sometimes lack is incorporating the upper body, because the upper body is so important for treating diastasis. It's not just the TA and doing marches and things like that.
Gosh.
Yep.
There's so much.
So it's
I'm like, I need to come see you again. I saw you postpartum, thankfully, but it's just a wild ride. And now my baby weighs more, so I'm picking her up differently.
Yep.
I'm not baby wearing, and now I pretty much have 2 toddlers. It's crazy.
I think you had I think we might have talked about this earlier. We talked about it at some point, but when it comes to seeing moms postpartum, it's like how long should they see you? How many visits is this going to take? And I'm like, honestly, I would love to see my clients throughout that first full year postpartum. And honestly, and that doesn't have to be like every week, or as you know, I don't see my clients every week. It's usually about every other week, but then we scale things out. And so especially as we get towards like the later part of the first year, so like 6 to 9 to 12 months, I'll see my clients about every 6 weeks, every 3 months, because again, it's just following you through those changes when baby starts to get bigger and we become more active. And I find that like a lot of my clients that get back into exercise, they forget about the basics. Yeah. And then I'm like, and then they're like, oh yeah, I haven't been doing that.
Yeah,
so
I need to get back into doing like the exercises, and like it's really just all about the fine movements. I think that's crazy too, and like probably a really good misconception that we could just bust right now is like you don't just need to work on your glutes or work on your abs. Like don't just do a bunch of sit-ups or something. Like there's so many accessory muscles that need you to focus on them first.
Oh yeah, I think about this as I kind of give this example sometimes to my clients, but I guess it depends on like who I guess what you understand, right? But so when I was early postpartum with my first, I did so well with like doing all of my exercises because I only had one child. So I was like, this makes it easy now, obviously, with 2. And obviously I know my mom's with more. It's just a lot more challenging to get those in. But my colleague I had obviously gone to her, pelvic floor physical therapist, pelvic floor physical therapist too. We need them too. Yep. And she had done my assessment and she's like, wow, your core is great. I'm like, yeah, it's awesome. So I go back into like, obviously workouts. I get back into CrossFit, which is like notorious for not doing a lot of accessory work. It's great for functional movements and like building strength. But if you don't do the accessory work, of course, things can be affected. And we were doing it was the company that I had worked with in St. Pete, but we were doing some type of like educational videos, and it was on Diastasis Recti, and I was the model. Perfect. And the colleague that had tested me had went to go do it, and she like had me do a plank, and she's like feeling, and she's like, so she's got like a 1.5, 2 inch gap. And I was like, wait a second. Afterwards, she was like, what happened?
Yeah, I'm like, you went backwards.
I didn't focus. I'm not focusing on the basics, like of being able to, keep the core strong. I mean, I was strong. I was obviously a lot stronger than I was early postpartum, but I had forgotten about some of the basics.
So even if someone has done that, they eased back into working out and then went into really big movements, how would they know they need to like, even like me, I'm talking to myself, it's me. So like now that I'm 8-9 months postpartum, like what would pop up where I'm like, dang, I really got to get back in with doctor?
I feel like, well, for one, it's funny that I like mentioned the dentist, because I feel like pelvic floor therapy is kind of like the dentist. Like you should do like your routine kind of like follow-ups every 6 months, obviously, unless like you're having symptoms. And so that's where if like you hadn't been to see, your therapist in a while, several months, 6 months, even a year, even more than that, like it's always good to like get in for a follow-up and just like a check-in. But again, obviously symptoms, like one of the things that I guess didn't even like connect the two for me when she had said that was that with overhead movement, so like heavy push press and heavy strict press, if I did not brace correctly, I had a lot of pressure down. So like I had, prolapse symptoms because of that. And it was probably because I wasn't managing my core and pressure right and strength right. So
it's really just like the intention you have to have in your brain of like, actively using all of your muscles, because this is just like instinct to just use the big muscles, I guess, you know.
Well,
like
yeah,
you
they're
have
global
to,
muscles, so
yeah, you have to like
gonna
intentionally activate like all the teeny tiny ones around it too.
And a whole nother thing, which obviously we don't have to get into all this, but like if you're still like nursing or pumping, you're still producing. So that's another thing that we factor in, is that there's still a lot of changes that are happening, you know, within the first 2 years, 3 years, 4 years, however long you're nursing for, you're still producing those hormones that are going to factor into elasticity within the tissue. And that goes for like core, pelvic floor, pelvic organ prolapse, all of that stuff
Yeah,
too.
because that could, like we said, it's not a linear journey. Like just because you're feeling strong doesn't mean like your body can fully support that. Just because you're breastfeeding, you're doing normal mom things. Like it takes an insane level of like intention and stuff.
Oh yeah.
So.
No, I'm like, I feel like even, I mean, I know obviously you're a nursing one too, but like me being early postpartum right now, I'm like, gosh, I can like, it's like you feel yourself like burning the calories.
Yeah, 100%. Literally. And like posture too is like a whole nother thing. Like nursing and stuff, it's so challenging, especially for me who's like prone to headaches and stuff. My chiropractor, you know, God bless him, but he's just like, is there anything where you're just like bending or reaching? And I'm like, all. Literally, yes, all of it. Like it's just always bending and reaching.
It's always down.
Yeah, like your shoulders curled in and then like, you know, leaning back. I didn't realize until I saw you really is like, as you hold your baby and you like lay them on your chest, like this terrible posture that happens, then you breastfeed. Like even right now, I'm like, God.
I know it's hard. Yeah.
So challenging.
But that's also where giving yourself some grace. And like, I feel like too prior, you know, I've been doing obviously pelvic floor therapy or pelvic health for a while now. And so I treated, you know, several years before I even had my first. And I would always like talk to my moms about like, you know, with breastfeeding, we should be in this specific posture and we should be doing it this way. And then after my boys, I'm like, no, you're going to do that however the baby tells you to do it and however you can do it. Obviously, yes, ideally, like if you can be in a more supportive posture, then do it. But like, I know for me, I have a crazy letdown. And so like, I had to be like fully reclined in this
like
awkward
brace
position so I didn't like waterboard them, you know? So it's just, but then I say, you know, if you can do exercises afterwards, so doing some thoracic mobility and some movements after you're done nursing, then that's going to be even more effective than just changing the positioning.
It's a huge key.
Yep.
Gosh, I feel like we just still in an hour, like barely scratched the surface.
I know. I was going to say, has it been an hour already?
Yeah,
okay.
It's like happened so fast. So is there anything else like you want people to know? Like if someone could go home with just like one thing written down somewhere, like, okay, you know, this is what Dr. Kate said, I'm going to put it in my back pocket. What do you want everyone to know?
Gosh, I would say that like, it's never too late. I think that that's something too, is that like moms, or I mean, oh gosh, there's so much, like my brain just got like flooded with things, but I would just say like, yeah, giving obviously all of mamas, but anyone out there with a pelvic floor hope. Like I say that anyone that pees, poops, or procreates should see a pelvic floor therapist at some point in their life, men too. And so I think that it's just that whether you've had these symptoms for 30 years, like there's still hope to get help out there. Even if for some reason you couldn't maybe afford or see a pelvic floor therapist during your pregnancy, it's still going to be helpful for postpartum, vice versa. I think that no matter how long you've had symptoms, that again, there is someone out there and support out there. I think a big one a big thing that I wanted to hit on too, just within like the therapy world, because I feel like I've been seeing this so much on social media now, is what is the pelvic floor therapist, right? So I think you had even to ask me that question, and it should be someone that is specialized. So someone that is a physical therapist, or so a doctor of physical therapy, or an occupational therapist. Those are who can do the advanced training and the clinical training to be a true pelvic floor therapist or a pelvic floor specialist. And so, you know, if you are someone that is wanting, you know, listens to this and is like, wow, I really need to go see someone. Of course, there's so many amazing pelvic floor therapists here in Jacksonville, but also just around the country. But it's just that you want to make sure that you are actually seeing someone that has had training and is certified in pelvic floor physical therapy.
I mean, are people out there just faking it? Like They're trained in it?
There's some things. Yeah, there's some things. I mean, they're out there and in the community. I think it's just that, and you see it so much, like even to, obviously being here in Jacksonville, like on our, the Crunchy Moms group or the Jacksonville Moms group and stuff like that, where they might see someone and say, oh, I went and did 6 to 8 sessions of pelvic floor therapy, and it's not actually done by a physical therapist or occupational therapist. It may be done by a nurse that got training in a special biofeedback unit, which isn't going to look at, again, the whole person, or it's, like a chair or some type of device that is marketed as pelvic floor therapy, but it's actually a device that can actually make symptoms worse, and so it's just making sure that you see someone that has the specialty training to do that.
Yeah,
so that's just one thing.
Just focus on the aesthetics or
So
like
just making sure that like if you go and see someone that it is actually like pelvic floor therapy, just because like even here, like I've had some moms reach out that have seen, which I did orthopedics. Obviously a lot of orthopedics goes into pelvic floor therapy. But someone that might say like, oh, they did, they had some pelvic floor training obviously in school. Cause thankfully I think it is being incorporated into PT schools a little bit more now, but that doesn't allow you to do internal assessments and stuff like that. So they're seeing moms for pelvic floor therapy, but they never even look at the pelvic floor. And so it's like,
or like you said, you're like, have you ever had an internal exam? Like there's people literally calling themselves a pelvic floor therapist, but not like truly looking and feeling all the muscles.
Exactly. Yeah. And like, I mean, obviously if, we're talking about like things related to like, obviously trauma and stuff like that, we never have to do an internal pelvic floor, but you should be seeing someone that can do that and can look at it and knows what they're doing. So I think that's like another thing that I just want to hit on because we're seeing it now so much in social media that they're like classifying themselves
it's like trending
and then,
to be a pelvic floor therapist.
Well, and to then you see in these groups that have like, I've tried pelvic floor therapy and it didn't work for me. And it's like, well, who did you see, and what did that therapy look like? And it's kind of the same thing. I mean, like, obviously I don't see this as much in my practice, but like, a hairdresser, right? If you got a bad haircut, you wouldn't just not get haircuts anymore. You would go and see another who can do it. Like, exactly.
Yeah. So, or someone who can look at your face and know and guide you the correct way.
The correct way. Yeah. Individualized care versus just like,
totally. So I just thought of one last question as we wrap up. So what does it look like to be a great like pelvic floor therapist? I guess what should people like expect when they go to see a pelvic floor therapist? What's a great, very holistic way of looking at things like you do? Yeah.
I think that for one, I guess I'll just kind of explain a little bit more about like how like I evaluate and obviously practice, and obviously it doesn't have to be exactly this way, right? There's so many different ways to treat, but again, it shouldn't be just like you come in, drop your pants, internal assessment, and we're done here. Or again, they just start doing exercises and don't actually assess what is going on with your body. So, of course, like you've seen coming in to see me, yes, of course we ask about like bowel, bladder health, sexual health, but I also want to know what's going on with like water intake, nutrition, sleep, your cycles, because that's going to tell me a lot about like what's going on with your hormones. What does your birth history look like? What does your pelvic history look like? And exercise history. What do you do for your job? Like I want to look at everything as a whole. What medications are you taking? What supplements are you taking? Because that's going to factor in so much to the pelvic floor, because a lot of pelvic floor dysfunction, it is a multifaceted thing. Even postpartum, right? We have hormones that are fluctuating. We have diet changing. We have water intake, sleep, like all of it, right? There's so much that we have to make sure that we look at. And then of course, diving into like functional movement. So like as a postpartum mom or a pregnant mom, like you have to look at how are you hip hinging, because you're doing that literally 50 million times a day. How are you squatting down to pick something up? Like what does your, are you having to constantly lift someone overhead, lifting, we have to look at function. And then of course I dive into, okay, what does your ankle mobility look like? Cause that's going to affect the hip. What does hip mobility look like? Cause that's going to affect pelvic floor, low back, rib cage, pelvis, all of those things, which thankfully, like I have the time, to do that with my clients. I know sometimes that it doesn't have to be, but at least some point in your journey in pelvic floor therapy. They should be
care
looking,
plan.
care plan, that you're looking at different things, right? And then of course looking at core and pelvic floor and developing a plan, for that going forward.
Truly should be holistic.
Yes. That's, I mean, of course I'm biased, but that's how I feel. And that's like where, with just how long I've practiced and really being able to develop my practice, that's why I see so much improvement with my mamas and
because
stuff.
You're thorough. It's truly all connected, so you have to treat it that way. Yeah,
and just looking at too from like, I look at it as longevity, right? Like I'm not looking at it for just right now, because you're going to be postpartum forever. But also too, we see like talking to our moms, like that our moms are like, especially my mom, she's like, wait, so I can fix this? Like I'm having some urgency. Like what can I do to fix that? And I'm like, well, tell me about what are you like, first let's start with diet. And she's like, well, I'm drinking all these seltzer waters. I'm like, well, that's probably part of your problem. But yes, also we probably have to like look at other things too. Yeah. But it all plays a part in all the things. Yeah. So important. Yeah.
So pelvic health is woman health. It truly is just such a foundational aspect of all we do as women, even when it comes to like literally just peeing every day. These things have to be in order for, like you said, quality of life. Like it's much more than like preparing for birth or recovering from birth. It's truly just quality of life, how you should sit, stand, bend, go to the bathroom, be intimate. Like all of this has everything to do with all of the muscles in your pelvis and abdomen. So I feel like this is really a good conversation. It was like very all-encompassing, hopefully not overwhelming, but also the tip of the iceberg. Yeah,
that's how I was going to say. It's only like scratch the surface. I mean, I could talk about this for hours and hours and hours, but no, I'm so happy that we were able to do this to like just bring more awareness to pregnancy, because I feel like
it can be isolating. Someone just feels like, dang, I pee myself all the time, I have leakage. I guess it's just how it is after you have babies. And that can be, like you even mentioned, an experience even as a younger like teenage girl, like isolating, like scary, probably like confusing, so
I know. And it's so funny because like I thought about this the other day, even back to that incident, but like I didn't ever correlate this, but I still remember that I was like sitting on my friend's bed and we were like laughing really, really hard. Yeah. And I like had complete bladder loss. And thinking back to it, I'm like, that was only like a month after my injury. And I was like, I thought about it because I remember like even now to this day, I was like, why did that happen? Like, and then I thought back to it and I'm like, oh my gosh. I think it was right after that had happened, because I remember being like, oh my gosh, like, and like, yeah, you think about, and that's where, I mean, obviously we could talk about this all day, but like young athletes, screening your athletes, like if you're a coach or something like that, if you hear someone bring something up, don't just completely dismiss it. And be like, oh, it's because like, again, you're overexerting yourself or you're running too hard or whatever it might be.
And it can be probably like so embarrassing and hard to navigate. Yes, so praise God for pelvic floor therapists.
Exactly. And just awareness. I mean, even right now, like obviously I have 2 boys, but we teach, Jackson obviously about anatomy and stuff like that.
Yeah, so important.
Yeah.
It's foundational. I love it. Well, thank you so much for your time. I feel like this will bless a lot of people, and like hopefully this just opens the door to you learning so much more about someone's own pelvic floor health, and you can go find someone to assess you and point you in the right direction and make an individualized care plan. But at least we kind of sprinkled in some of the things that are super common to come up against, and wish you the best on your journey. There's so many variables that come in and out of life, so you add in the babies and all the bending that comes, it's just crazy. It's always just changing.
Knowing that there always is someone out there. And so like, even if, because I mean, we need more pelvic floor physical therapists, or pelvic floor therapists in general, not only in this area, but just obviously in the whole United States. But obviously, thankfully, like virtual. So like if you're in an area too that you might not have someone, then you still at least can see someone virtual, and that can still be very, very helpful.
There's like all kinds of stuff.
Yeah, there's a lot that you can do. So yeah, you're welcome. Thank you. I know this is so fun.